I focus on improving care for families who, during pregnancy, learn that something serious is affecting the health of the child that they're expecting. Some prepare for complex surgeries and neonatal intensive care, others palliative care, and some are faced with the difficult reality of navigating care when continuing the pregnancy may not feel like the right choice for them. So a lot of what I study is what kinds of barriers get in the way for people to get the information and the care that they need in order to make decisions about the health of their baby and their family. So while some families are getting diagnosed prenatally, others aren't getting this diagnosis that there's something wrong with the baby until after the baby's born. So let's use spina bifida as an example. And so that is where they are looking at correcting the hole that is there in the spinal cord. And then once they've completed that, they close the incision, the pregnancy hopefully continues, and then once the baby is born, they're better off in some ways because of that procedure having happened. But what we're seeing, not just from the stories that people tell us, that there are some differences in what they received, but then we go and we look at that at the national level and we see 50% of the Medicaid population who had children born with spina bifida were not diagnosed until after birth. That is a huge unexpected number that we found. And what we saw was that those who had an alpha fetal protein test, this blood test, were 3 times more likely to have had the condition detected prenatally. So when we think about policy changes at the federal level, this is something that can make a difference at the federal level to say, let's incentivize not phasing out alpha fetal protein. Let's remind people this is actually very valuable. And I think that's what Penn Nursing does so well, is we are able to both think about both what's happening on the ground, the individual stories, being able to really connect with those people, and then take that and zoom out and think about what does this mean at a systems level? What does this mean for health policy? And especially in today's climate, what can we expect from the changes that are happening? This touches not just women and children, but all members of the family.